If you advocate for yourself, you're just dramatic.
Mm.
I see that a lot, like, mansplaining or medical gaslighting, like, oh, here she comes again asking a million questions. And therefore, you almost feel, I go back to that kind of pathological accommodating, like, okay, I'll just sort of lie in the quiet and I won't upset any apple carts. And I've had to really force myself to focus more on the result that I want to produce as opposed to, do you like me at the end of this engagement? Because this is my health, my well-being, my life. Like, in the same way in dating or in scrutinizing, like whether I want to take this job, or in a lot of big decisions we make, if we don't self-advocate, we cannot then play the victim afterwards. We've actually, in going along with the story, we've actually chosen. By not choosing, we've still chosen. By not asking questions and not doing due diligence, we've still chosen something. So self-advocacy, if we don't do that, we injure ourselves actually. But it is difficult because there's a shaming that happens amongst authority figures if you self-advocate. It's almost like, no, I know best. And this is this hierarchical thing that the world that we live in. But what I'm loving about social media, AI, all these changes that we're seeing, one of the most unscary parts of it is it's flattening the hierarchy. There's some clients I work with that cannot advocate for themselves. I had a client who had a traumatic brain injury and she wasn't able to advocate for herself. And I'm like a lioness when I go into advocating mode. Like there's like a lawyer or something that gets exploded in me. And I'm just like, no, we will get a different solution and a different outcome. And luckily I've had some successes with some people that I've worked with that has been life-saving. Some people that I've worked with that are on cocktails of 27 meds a day, they've got scurvy, their teeth have fallen out. They literally have like medically induced lupus because the cross combinations of all these like cocktail of drugs that they're on were never checked by whoever administered them. Because everyone who administered them in their silos. And the GP, poor GPs, they get 7 minutes to review each patient because there's pressure to keep turning people through the system. So the system is really struggling with all these components. And I don't think we can hold any one person personally, like it's your fault. It's endemic in the system. So it's just challenging. So that's why self-advocacy is so important. And you got to get yourself to a place where you don't care if you're disliked. It's almost the courage to be disliked, the courage to actually go, no, I don't agree with you and I don't feel comfortable with this. And I want to see the science behind what you've just recommended. And I don't like what you're saying, or, just actually speaking up.